Hi everyone, it's Laura again from Peak Form. I've got another video for you today with a couple exercises to help you if you've got some symptoms of hip arthritis, osteoarthritis. So as I've mentioned in another video about knee arthritis, it's one of those wear and tear conditions, one of those gifts of aging. So the main treatment when it comes to arthritis is actually to keep yourself moving. As much as it doesn't feel good to move, especially in the morning, the more you move, the better you'll feel. The more those joints can get lubricated and the stronger your muscles are gonna be. So, as I've mentioned before in our blog posts and in other videos, once osteoarthritis is there, it's there, but we can help strengthen some muscles around the joint so it can offload the stresses a little bit. So 3 exercises for you today to help with your hips. It's gonna get the knees too, but the focus here is your glute muscles and your hip abductors right on the side. So the first one is a mini squat. So what you're gonna do, you're gonna have your feet about hip distance apart. You don't need to be real wide here. So just about hip distance. And the trick here is to really think about pushing your butt out behind you before you bend your knees down. So it doesn't need to be a really big range of motion. All you're doing, stick that butt out like you're sitting in a chair, drop down maybe halfway, hold for a few seconds, and then bring yourself back up again. Really focus on squeezing on the way back up. As you come down, you'll feel it in your quadriceps, so stay within a range of motion that feels comfortable, and then you bring yourself back up again with a little squeeze at the top. I like to give those for knees and hips. It's a real functional movement. You have to be able to squat down to get in and out of chairs, on and off the toilet. Really, a lot of functional activities involve squatting, so that's the first exercise. The other 2 are gonna be on your back and then on your side. So start on your side. This exercise focuses on those hip abductors, those muscles on the side. So what I want you to do is have one knee bent. This top leg is more or less straight in line with your body. It might even be a little bit behind you. So from here, I want you to lift your leg up. You're gonna hold it for a few seconds, and then you're gonna bring your leg back down again. For this one, be real careful not to let that knee travel forward, because then you're using a different muscle group. Make sure this leg stays straight, almost a little bit behind you. You won't be able to go up as high, but you'll feel it really work in your hip rather than in the front of your hip. You'll feel it in the back, which is where we want it. So this one's called side lying hip abduction, because you're literally laying on your side, abducting your hip. It's not the most functional exercise. We don't walk with our legs out to the side. It's a little kind of funky exercise, but it's designed to strengthen those muscles in the back of your hip. Last exercise is a bridge, and this one I give for knees as well, because we need strong hips to support our knees. But for this one, what you're gonna do is be on your back again. Bring your heels real close to your butt, real close as you can get them, because this is gonna target your glutes a little bit more. If you have them further away, you'll get your hamstrings. Not a bad thing, but for this one, focus on those glute muscles. From here, you're gonna push up, bring your hips toward the ceiling, hold for a few seconds, and then slowly bring yourself back down again. Rinse and repeat. Push into the table, bring your hips up toward the ceiling, hold for a few seconds, and then bring yourself back down. So with any of these, they should be relatively easy. You don't need equipment for any of them. But if they cause you pain, any discomfort, anything like that, give us a call, let us know. If you need an appointment, come right in. We're still treating patients. Please come and see us if you need help with anything. Don't feel like you need to suffer alone. So we've got more videos coming for you soon. Hope these help. Give us a call if you have any questions. Thanks, guys.